Yeah, that's right. Hello, everyone. I stand before you today to shed light on an extraordinary organization that has been on the forefront of delivering medical care to those in need around the world. It is my pleasure to introduce you to the Doctors Without Borders, or Médecins Sans Frontières. Imagine a world where borders and conflicts no longer hinder access to healthcare. Imagine a world where medical aid reaches even the most remote and forgotten corners of the globe. Doctors Without Borders has been transforming this vision into reality since its inception in 1971. Doctors Without Borders, as the name suggests, is an international humanitarian organization that provides medical assistance and healthcare to people affected by crises, uh, be it armed conflicts, epidemics, natural disasters, or emergencies. This unwavering commitment to delivering essential medical care, known as No Boundaries. This organization operates on a simple but powerful principle to provide medical aid based on medical need alone, regardless of race, religion, or political affiliation. By adhering to this principle, Doctors Without Borders has gained a reputation for impartiality and independence, setting a high standard in the field of humanitarian assistance. And next, my fellow teammate Alma is gonna take over after that.
So, Doctors Without Borders, or Médecins Sans Frontières, is a organization that's all across the world in many nations, many countries, and it's been here since December 22nd, 1971, and they try to push the boundaries that are set in place at the moment, where they want to give medical care to people who really need it, no matter who they are, what they believe in, or what side they are on. Next slide. The founders of the organization came 51 years ago. It's going to happen, and it's full of groups of doctors, journalists, and it was like all during the wake of the war and famine in Nigeria. Some of the people who founded the organization are Bernard Kouchner, Gerard Louise, Vladin Roman, Raymond Borel, Philippe Bernet, Jean Carroll, Jacques Beris, Max Recamier, Xavier Emanuele, Marcel Deroux, Pascal Greze Bosville, and Gerard Pigeon. And there's many leaderships in this organization because there's a lot of them around the world in many different countries. But for in Canada, there is 9 of them, and there's Angelina Rowan, Hosen Autry, Emmanuel Gilwad, Joseph Belouive, Kathy Manipo, Fiona James, Clara Mason, Sarah Lamb, and Shia Courier. The vision of the organization is something goes along with the mission, but their vision is to help anyone who is in need of help, no matter like country they're from, beliefs, religion, political, or like sexual orientation. They just want to be able to help the people in the world, no matter who they are. And the mission is to provide emergency medical care for people who are affected by epidemics, disasters, conflicts, and they don't want to exclude anyone from having the proper health care. There are 4 principles that this organization goes by: impartiality, neutrality, independence, and medical ethics. So the first one, impartiality, they want to make sure everyone feels equal. They don't want like no one in this world, we're all the same. Everyone in this world is the same. They don't want no one feeling excluded or like making them feel like, oh, they don't deserve it. Like everyone's equal to having like the same suffers, and everyone should have the right to have proper health care. They don't like to discriminate, and they want to help anyone who needs it, but of course, going from prioritizing to people who need it most. Neutrality is the principle. They choose to stay neutral no matter what. Like, they don't focus on political backgrounds or what if they're on the opposing side. Like, they might encounter wounded citizens or soldiers from the opposing side, but that's not going to stop them from helping them. And then independence is many of the donations from like donors. There are a lot of them that are like a large majority is from private donors, but they also want to make sure they don't like take any donations that would make them like base their choice on their political aspects, their ideas, their like any objectives on them that would exclude other people who might need help. So this principle helps them stay true to what they believe in, helping people who like what they need, and the financial helps them respond quickly to medical emergencies. And then medical ethics, they want to make sure everyone has the right for proper health care and giving them the best medical care. They don't want to cause harms to any individuals or groups. So when it comes to the patients, they try to give them the best care they can, keeping their confidentiality if they choose that, and giving them their right to choose what happens. And sometimes when it isn't enough, they might have some shelter, some water, some food, anything that they might need. And then
Okay, so for the strategies, this organization, this organization has three strategies. Is my background too loud? No. Rapid response. One of them is rapid response. There's MSF has the capacity to quickly mobilize and deploy teams of medical and logistical experts to respond to emergencies such as outbreaks of infectious disease, natural disaster, or mass casualties. MSF also maintains a network of emergency supplies and equipment that can be dispatched within hours to any location in the world. And number two is field operation. MSF works in over 70 countries, providing a range of medical services such as basic healthcare services, vaccination campaigns, nutrient programs, mental health support, and maternal health and child care. MSF team works closely with local communities and health authorities to identify and address their needs and challenges. MSF also adapts its intervention to a specific context and constraints to each situation, such as insecurity, lack of infrastructure, or cultural barriers. Number three is collaboration with local healthcare providers. It recognizes the importance of working within supporting local health actors, such as Minister of Health, hospitals, clinics, and community health workers. MSF aims to strengthen the capacity and resilience of local health system by providing training, supervision, mentoring, and maternal support. MSF also advocates for the improvement of access and quality of healthcare for vulnerable populations. So projects and results, what have this company done over the time is in 2010, the Haiti earthquake, it launched one of the largest emergency intervention in the history after a devastating earthquake strike Haiti, killing hundreds of thousands of people and displacing millions. They set up field hospitals, mobile clinics, and mental health programs, and treated more than 350,000 patients in the first year alone, and also responded to cholera outbreak that affected more than 100,000 people, opening treatment center and conducting public education program campaigns. And crisis in Somalia in 2011, severe drug conflict and collapsed health system worsened the humanitarian crisis in Somalia, where hundreds of and thousands of people fled to neighboring countries or camps, such as search for help. It also scaled up its activities in Mogadishu and other regions, providing basic healthcare, surgery, nutrient programs, cholera and measles treatment, vaccinations, and maternal care. It also supplied relief items and water to displaced and local populations. It also had a project in civil war in Syria, where in 2011, the conflict in Syria has devastated the country's healthcare system and caused millions of people to flee their home or seek refuge in neighboring countries. It has been providing medical care to people inside Syria, as well as in Jordan, Lebanon, Iraq, and Turkey. The teams performed surgery, treated war wounds, supported vaccination campaigns, delivered babies, and provided medical care. MSF has also spoken out about the attack on medical facilities and staff, the difficulties of accessing humanitarian aid, and about the West Africa Ebola outbreak in 2014 till 2016. The largest Ebola outbreak in the history affected several countries in West Africa, killing more than 11,000 people and infecting more than 28,000 people. Uh, the organization was the forefront of the responding, deploying more than 4,000 staff and opening Ebola management centers across Guinea, Liberia, and Sierra Leone. It also conducted a contact tracing, health promotion, safe burials, and survivor care. It also advocated for more international support and research on vaccines and treatments. And we can't forget about the displacement in South Sudan. Since 2013, civil war and violence have forced millions of people to flee their homes in South Sudan or seek refuges in neighboring countries. It has been providing medical assistance to displaced people in camps across the country, as well as refugees in Ethiopia and Sudan. MSF teams have offered basic healthcare, surgery, nutrient program, mental health support, and maternal and childcare. It has also responded to outbreak of cholera, malaria, measles, and Kala Azar. The global impact of this organization is really huge. So number of countries and scale of, if you want to talk about number of countries and scale of intervention, the organization has worked over 70 countries, providing a range of medical services such as basic healthcare, surgery, vaccination campaigns, nutrient program, mental health support, and maternal and childcare in 2020. It has also conducted more than 11 million outpatient consultation, admitted more than 750,000 patients to hospitals, assisted more than 300,000 deliveries, treated more than 2.8 million cases of malaria, vaccinated more than 1.5 million people against measles, and distributed more than 4.3 million relief items. And one of the global impact is positive impact on affected communities. The organization delivers emergency medical aid to people who need it most, regardless of their race, religion, creed, or political conviction. It helps to save lives, ease suffering, and restore dignity to people affected by conflicts, epidemics, disasters, or exclusion from healthcare. MSF also provides psychological support and counseling to help people with trauma and stress. The organization team work closely with local communities and health authorities to identify and address their needs and challenges. Recognition or awards. The organization received several awards and recognition for its humanitarian work, such as Nobel Prize in 1999, the Indira Gandhi Prize in 1996, the Seal Peace Prize in 1996, the Lasker Boomerang Public Service Award in 2015, and the Hilton Humanitarian Prize in 1997. It has also ranked among the top international charities by various organizations such as Charity Intelligence Canada and GiveWell, and its positive impact on local healthcare system. It recognizes the importance of working with and supporting the local health actors, such as ministers of health, hospital clinics, and community health workers. It aims to strengthen the capacity and reliance of local health system by providing training, supervision, mentoring, and material support. It also transfers skill and knowledge to local staff and partners through on-the-job coaching and formal courses. It also supports the development and implementation of innovative medical tools, practices that can improve the quality and accessibility of healthcare. So it has a positive impact on broader global health landscape. It not only provides medical care but also bears witness to the plight of people it assists, and it also speaks out about the cause and consequences of humanitarian crisis and advocates for the improvement of access and quality of healthcare for vulnerable populations. It also conducts operational research and specific analysis to improve its own innovation and to contribute to global evidence based on medical humanitarian issue. It also collaborates with other organizations and network to share its expertise and experience. The financials and employment opportunities that this organization is linked to. It has unique financial structure and funding sources that enables it to maintain its operational independence and flexibility. So one of the financial source is it composed of 23 main national office, 9 branch office, 9 satellite organizations, and international office. These entities are legal autonomous but coordinate their activities through common platforms and bodies. It relies on individual donors and private institutions for 97.2% of its operating funds in 2022. More than 7 million donors and private institutions raised 2.2 billions, to which US so need to buy a premium to get unlimited time. So it's a limited time. I didn't know about that. For unlimited meeting. It's up to 60%. In 2022, more than 7 million donors and private institutions raised 2.2 billion, to which US donors contributed to more than 540 million. Public institutional agency providing funding to MSF included, among other, the government of Canada, Japan, and Switzerland, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and the International Drug Purchase Facility, and also importance of donation and private fundings. The organization's high level of private income allows it to respond quickly and independently to humanitarian emergency without being influenced by political or economic interests. It also uses its private funds to speak out about the causes and consequences of humanitarian crisis and to advocate for the rights and needs of its patients. The organization's private donors are essential partners in its medical humanitarian mission as they share its value and vision of providing impartial and quality care to people in need. And employment or volunteer opportunities. The organization recruits medical and non-medical staff from various backgrounds and professions to work in its projects around the world. It also offers competitive salaries and benefits, as well as opportunities for personal and professional growth. It also welcomes volunteers who can contribute their time, skill, or resources to support its work at home or abroad. Individuals who are interested in working or volunteering with MSF can explore the available opportunities on its website or contact their local MSF office. Okay, so we came to the end of the presentation. So here's all of the references where we got our information from. As a conclusion, we deliver deeper into our understanding of Doctors Without Borders. We will explore their remarkable journey and the incredible impact that we made by this presentation and the challenges they face in their mission to heal, save lives together. Let's appreciate the extraordinary work of Doctors Without Borders and draw inspiration from their tireless dedication to humanity. This is me, Sandip Neupane, and my teammate, Alma. Do you want to say out your name yourself?
Mutapcic. Mutapcic.
Let's stop this.